Today we are going to discuss about the DRAF procedures. What are DRAF procedures? They are surgeries which are done to access the frontal sinus. What is the full form of DRAF? Nothing. It is the name of a scientist. Name of the scientist who first described the procedures. So there are 4 types of DRAF surgeries. DRAF 1, 2A, 2B and 3. And I am going to describe it in a way that it can become easier for you to remember these, and so that when it is asked in the exams or in the Viva or in your MCQs, you can answer it easily. So let us assume that this is the nasal septum and this is the frontal sinus and this is the intersinus septum. Intersinus septum is a septum which divides the frontal sinus into 2 parts, and this is the nasal septum. So in DRAF 1 procedure, let us say that we have not yet reached the frontal sinus. We have only cleared the sinus which lies before that. So which sinus lies before the frontal sinus? When we are doing FIS, which sinus do we access before entering the frontal sinus? These are the ethmoids. So we have cleared the ethmoids, that is ethmoidectomy, and we are clearing all the air cells which are coming before the frontal sinus. So we remove the air cells before frontal sinus. So that is DRAF 1. Now in DRAF 2 and 2B, the common thing is lamina papyracea. Lamina papyracea is common. So in 2 and 2B, we will be clearing all the cells between lamina papyracea and one another structure. In 2A, it becomes middle turbinate, and 2B, it is the nasal septum. So suppose this is the lamina papyracea and here comes the middle turbinate. The lateral limit of the debridement will be lamina papyracea, and the medial limit will be middle turbinate in 2A, and in case of 2B, the lateral limit will be nasal septum. So how to remember this? AM, right? 2AM. So in 2AM, A stands for 2A and M stands for middle turbinate. So in 2A, we are accessing the cells between lamina papyracea and middle turbinate. In 2B, we are accessing the cells between lamina papyracea and nasal septum. So this we are done about DRAF 2, and DRAF 3 is the most extensive one. So in DRAF 3, we will be removing 3 structures. We will be removing, this is the frontal sinus, this is the intersinus septum. So we will be clearing the intersinus septum. We will be clearing the intersinus septum. We will be clearing the floor of the frontal sinus, and we will also be clearing the superior part of nasal septum. So all this we will be clearing in DRAF 3. So let's revise it once again. DRAF 1, 2 and 3. In DRAF 1, we are only doing ethmoidectomy and cells lying before frontal sinus. In type 2, we have two type, 2A and 2B. 2AM, that is middle turbinate. 2B is nasal septum. And the lateral limit is lamina papyracea. And type 3 is, three structures we are removing: intersinus septum, floor of frontal sinus, and superior part of septum. So we are removing all these structures to access the frontal sinus. Alright, so this is all about the DRAF procedures and a way that you can remember it easily. And I hope you liked the video. It was something to learn about and it was something to learn from. And please follow us and like the video and share it among your friends so that you can get to know some more topics from ENT in an easy way and in a way that you can remember it lifelong. Thank you.